Good afternoon. It's a pleasure to be here. It's really an honor to have been invited to share thoughts with you this afternoon. And what an ambitious goal to make our country the healthiest nation. Now, some things require a stretch, and some things require a leap. For us to become the healthiest nation, we all know the data is going to require more than a stretch. And so I want to have a frank conversation with you today about the role of public health in getting us there. Just to establish that as an intention is a very, very powerful breakthrough admission. Breakthrough in the sense that it is going to override the dominant belief in the public that we are the healthiest nation. The average person subscribes to the theory that America has the best health care, and therefore we are the healthiest nation. And we've seen the data, and we know globally we are far from that. And I concur with Dr. Stephen Wolfe, who suggests in a commentary in the Journal of the American Medical Association that it is our policies that are not specifically health policies that are making the greatest contribution to our poor standing globally, the greatest contribution to our less than ideal ranking in terms of being a healthy nation. Dr. Wolfe has been researching this for many years, and he reminds us that when we don't have effective education systems, and we are not educating all of our children equally, we are contributing to poor health outcomes. When we don't have an equitable opportunity for employment for all of our nation's people, when we don't have a safety net that undergirds people during those periods of lack of employment, when we continue to make policy decisions that lead to instability and insecurity, particularly economic insecurity, we are contributing to poor health outcomes. Now, this is not news. When we don't have affordable housing, we're contributing to poor health outcomes. So the Public Health Association and the work of the public health community moving forward to achieve this ambitious goal requires standing up for policies that are not always directly health policies or even health care policies. We have a huge national constituency in terms of public health, and this constituency must be mobilized to stand up for those policies that are necessary to assure well-being. Now, I bring you greetings on behalf of the W.K. Kellogg Foundation, on behalf of our president and our executive team that are hard at work back there in Michigan. But our mission, when our founder left his fortune to us, he said, do what you will with the money, so long as it helps children, particularly vulnerable children. And about 8 years ago, we took a look at the data and we recognized that most of the children born in this country now and in the immediate future are children of color. And most of those children are growing up in either low-income or impoverished communities and neighborhoods. And so we asked ourselves, what is the work that needs to be done to propel those vulnerable children to success? We honed in on a social determinants framework, focusing on education, focusing on access to food and quality health and well-being within their communities, and family economic security. But we also understood that it was time to develop a very explicit agenda about addressing the legacy of racism that helped to shape the culture of our country. I will share with you some of the insights that we've gleaned from funding many, many groups around this country who dare to have the courage to thoughtfully and carefully and reflectively tackle this challenge. But in general, the philanthropic world has moved this concept of social determinants of well-being forward, and they are embracing it. The Robert Wood Johnson Foundation's Creating a Culture of Health initiative is one powerful example. The California Endowment's Building Healthy Communities. Place-based work has been the hallmark of many investments for major national foundations for a very long time. I always tell people there's some advantages to growing older. None of them are physical. But you do live long enough to see ideas go from a nascent state to actually being embraced and actually becoming the norm almost. So as a partner with public health, the philanthropic world is right there with you in terms of understanding that we have to create the conditions that allow for health and well-being. And that's one way to define public health. It is what we as a society do collectively to assure the conditions in which people can be healthy. And that's why I believe the Robert Wood Johnson Foundation's focus on the culture of health is a breakthrough framing for us. Because, you know, when you talk about social determinants of health and you talk about life course perspective, you know, it's wonk speak, right? And the average person sort of glazes over. And so we need ways to communicate and galvanize and move people that folks can understand. Now, Gandhi once said that the culture of a nation rests in the hearts and the souls of its people. Our work on racial equity would agree with Mahatma Gandhi, but we'd also modify that and say that the culture of a nation rests in the hearts and souls and minds of the people. In this age of the brain and brain science and neuroscience, it's very clear to us that the legacy of a belief in a hierarchy of human value, or racism, and all the other isms that deny opportunity and discriminate based on physical characteristics, that this hierarchical belief system has been such a part of the DNA of our country for so many centuries. We've had episodic moments of protest against it. We've had a civil rights movement. We had a civil war. We had a Reconstruction period after the Civil War. But these episodic spikes in protests are then followed by periods where things return to the status quo. So the issue today of the legacy of the belief in human hierarchy is not the same as it was in the 20th century. The issue today has as much to do with unconscious bias as it does conscious bias. And neuroscience is helping us to understand how the need to categorize and create schema is just a part of being human. It's what we do. I don't look at that chair and say, oh, that's a back and a seat and 4 arms, 4 legs and 2 arms. Aha, that's a chair. My brain has categorized that image to know when I see it, and I have an automatic assessment that that's a chair and I can sit in it. We've been bombarded for so long with stereotypical projections and impressions about the other and about difference that we have done the same type of categorization and created the same types of schema about people. And those responses become automatic. So this work on unconscious bias is a necessary component to getting us to be the healthiest nation. Now, what do I mean by that? I mean that exposure to discrimination and denied opportunity or inequity in opportunity based on residential segregation and other factors or patterns of disinvestment, those are critical components or barriers to realizing our dream of being a healthy nation. We simply have to put this work right into the heart of our agenda for change. Every person that can make a life and death decision about others should know where they are vulnerable for being biased, and they should have the tools and the resources at their disposal not to act on those biases so easily. Now, we know that the most lethal decisions are made by law enforcement, and in some cases by healthcare. And so those are two primary communities for intervening to overcome these automatic and deeply entrenched biases. And that isn't going to happen without investments. It isn't going to happen without acknowledging that it is part of our work. And so when we talk about, you hear these lighthearted, they're not lighthearted, that's not appropriate, but you do hear these references to, we need as a nation to have a conversation about race. And a lot of us glaze over and say, I don't want to talk about race. Or we had that conversation. What I'm suggesting to you is that today's science is showing us that it's more than a conversation. It's assessment, it's recognition, it's accessing the tools and resources within communities to help us overcome the legacy of an entrenched belief in a hierarchy of human value. Now, public health of the 20th century accomplished so many things. Indeed, the general public doesn't really understand all that public health did to make us the nation we are today. It's a funny thing, when something becomes ubiquitous, we just don't see it. I'm reminded of the struggle we've had and continue to have on the issue of lead in the air and now, more importantly, in the drinking water systems in our nation's schools and communities. But lead was such a ubiquitous element in our culture that it took a concerted effort to identify it and get policy changes and ultimately get solutions to the problem. We're not finished with that. But I equate this idea of bias in our society as something like the lead problem. It is ubiquitous. And as a consequence, we often don't even see it. And we don't see it, but we certainly see its outcomes. So the public health field has used the technology and the knowledge of its era to make major, major victories. It has also used the population's values and concerns. Now, the general public right now was mobilized to be very concerned about public health when they were terribly frightened of the possibility of the Ebola virus being in our society. We heard more about public health in that brief window than probably we have heard in the last decade. And yet, gun violence in this country kills at least 85 people a day. And we are not up in arms about gun violence. One of the things we have to do is do a better job of framing for the public the real threats that we face in terms of our well-being. And we, a violent nation, cannot be a healthy nation. This idea that we are entertained by violence, that mainstream television and cable television and all the other televisions and the motion picture industry, wherever we turn, we see violence as a form of entertainment. We've created a culture of violence. And then the issues of gun safety, the issues of the proliferation of guns in the hands of children. This is a public health issue. And I know there's tension around that, and some of us dare not speak it, but I just came from Chicago last week. And that's a community where 25 and 30 people die on a weekend from gun violence. So something has to be done about that. And the disparate numbers of children of color who are dying, this is part of us becoming the healthiest nation. So how do we get to be a culture that really values health? I think we have to redefine what we mean by health. I think we have to focus people's attention on the miracle of the human body and its capacities to be healthy. We have to get people to understand that health is truly an option. And that's a different kind of literacy. It's not necessarily only medical literacy. It's literacy about health and the human body. It's literacy about how stress, allostatic load, and continuous exposures wear at the body's capacity to be resilient and to be healthy. Now, the knowledge of this century, all this amazing technology, but also the exploration of the human genome and epigenetics. I think epigenetics is the most exciting frontier because finally we're going to be able to understand not only that stress and disadvantage and discrimination and inequities predispose us to being ill, but we're going to be able to better understand the physiological pathways as to how those burdens actually tax our systems and make us more likely to be ill. And David Williams and Jack Shonkoff at Harvard are doing some amazing work on identifying the biomarkers that reflect increased allostatic load. And there's so much work going on now around childhood adversity and toxic stress and how that predisposes to a lifelong vulnerability to chronic disease. But what I'm most excited about in Dr. Williams' work is he's showing that even if you have too much exposure to adversity in childhood, if you don't grow up and have to live in communities where the opportunities are still unequal, you don't have to manifest the chronic disease vulnerabilities that were predicted based on your childhood adversity exposures. So, in conclusion, I would be remiss if I didn't say we will not become the healthiest nation without addressing the legacy of a belief in a hierarchy of human value, or that's my polite way of saying racism, and the other isms that divide us. That is part of our work, but there is a science and there is an art to that work, and we must integrate that into our priorities in terms of public health. You know, perhaps the greatest mind of the 20th century, he's acknowledged as that anyway, was Albert Einstein. And of all the hundreds of books that have been written about Einstein, only one of them chronicles his commitment to overcoming racism. I highly recommend that book. He was friends with Du Bois, he was friends with Paul Robeson, he stood behind the NAACP. He was committed to overcoming, and I'm going to end with a quote from him. In 1946, he said, "I do not believe there is a way in which this deeply entrenched evil can be quickly healed. But until this goal is reached, there is no greater satisfaction for a just and well-meaning person than the knowledge that he has done his best in an effort in this cause. So our greatest mind of the 20th century reminded us of the importance of this task. And I was invited here today, I'm sure, because they knew I would remind us that this is part of becoming the healthiest nation. Thank you.